Speaking of that title sponsor, we are very happy all week to feature some of the fine providers of Springfield Clinic Orthopedics and the Orthopedics Walk-In Clinic at 800 North 1st. Today our guest is Dr. Brett Western. And Dr. Western, welcome out to the shed.
Thank you.
You're experiencing about a 20-degree improvement from yesterday, as I told you.
I knew I picked a good day.
It's better. There's a breeze. Dr. Western, tell us a little bit for the listeners about your practice and what your parameters of your practice are with the clinic in the orthopedic group.
Okay. I've been at Springfield Clinic since 2002, and pretty much that whole time I've done non-operative orthopedics, and over the years we developed this walk-in clinic that has catered to people who have any sort of musculoskeletal issue, whether it's an acute injury or not, that they need to get in, whether it's more convenient or just more urgent than when they can get into their own doctor. We kind of perform services that aren't necessarily offered as readily at some of like the other walk-in clinics,
Sure.
like the more medical-based
Alternative to the
Yes.
emergency room.
Right, and it's
Alternative to no
Yep.
appointment at other clinics in town, but still specialized. So you could get a work-related injury, you could get a sports-related injury, you could get I fell in my garden this morning.
Absolutely, we get it all, and a lot of arthritis too, and just anything that someone needs to be seen for that's orthopedic related. We're there. We're open every day for walk-ins on the First Street building, and it's 7 through 6 p.m. Monday through Thursday, 7 to 5 Friday, and then 8 to 11 on Saturday. So we're there.
And so if you get hurt in a football game Friday night, you're there on Saturday morning, right?
A lot with that's for. Yes, we're very busy Saturdays.
I think one of the trainers had pointed that out to me
Right.
early on about the Saturday hours.
So yes, if you're not a football player in the fall and you don't want to wait, Saturday morning's probably not the time for you to walk in.
Okay, fair enough. You deal with a lot of pain issues. You do injections. There's a wide range of services.
Yes.
As healthcare evolves, this is just one of the models that's been brought forward for patient convenience, not having to go through so much to be looked at. It could turn out to be something serious, but a lot of this stuff, I think Dr. Young told me yesterday, 70% of the presenting things don't need surgery.
Right. Yeah, at least that. There's many hours of many days to be spent treating things that don't need surgery at that time or in the future, but a lot of things that we see maybe non-operative at that time, but maybe a year, 2 years, 5 years down the road, that situation changes. So we still have all of our surgical partners right there with us that pretty much take care of the rest.
Our theme today is talking about kids in sports. You have a particular interest in this field. I'm sure you see a lot of young athletes.
Yes.
There's some things you wanted to share that might be helpful to our listeners about things that you see or things that you've observed about kids in sports. What are the big themes that you see as you're treating the younger athletes?
I think, I see this from three different ways. One as a parent, one as someone who has coached youth sports, and then as a physician, obviously. From the medical perspective, as kids and parents have felt more of a need to specialize in something
absolutely.
And just do one sport and do that all year round, we tend to see more overuse injuries, things that you normally wouldn't have seen in a teenager 25 years ago,
Right.
that you may have seen in an older college player, professional player. And the other thing, too, is just the amount of practice in games and travel and these things. These kids are spending so much time doing scheduled things and regimented things and things that are directed by somebody. They're not learning a lot of these other skills, movement patterns and things like that. And so they end up having weak hips or back pain and things like that just because they are only doing a few specific things all year round.
And, I'm a layman, but involved in sports as I was as a coach and with a kid in travel. I always thought that, too. There's just a fatigue to this 12-month season.
Right.
The younger body needs time, just like the older body, to heal, recover, take a break. And we even saw that, I think, to some degree with multi-sports athletes who still just didn't have a break.
Correct.
But you're right. We now have kids who concentrate on one sport 12 months a year.
Right. Well, and the multi-sport athletes, even if they didn't get a break, if they went from football straight into basketball, those movements, those activities are completely different.
Right.
Even if there wasn't the actual rest, there was
Right.
still a different movement pattern and a different stress put on the athlete. And, you know, there may be injuries, but not the unusual overuse tendonitis, you know, tendon tears, ligament tear type things that, you know, you wouldn't always expect to see in that age group.
And you are speaking, if I might, more to the parent here about regulating their child's activities, their child's amount of rest, just things to think about when you have that athletic child.
Absolutely.
It's hard for a child to put a governor on any of his activities.
Right. I mean, parents have the ultimate control.
There'd be no pitch counts if the kids didn't work.
Right. It's hard, you know, coming as at this as a parent too. You know, you think you're going to do one thing and you end up doing something else just because you see the kid and they're having fun, or that you want them to have more fun, or you want them to succeed in some way that you think this will help them do that. But, you know, in the past I'd always said, well, 2-week break between seasons, and, you know, some people just think that's ridiculous. You know, I have 13-year-old girls who will play
You'd probably like to say more than 2 weeks, but you're aiming for 2 weeks, right?
Right, and so there's you know, it's different now too. So a lot of times school sports, I see this a lot with volleyball, where the girls will be playing softball or basketball for the school, but they're still playing their year-round volleyball club stuff. And I, you know, in the past, you just didn't see that, and those, you know, it sets them up for some issues. So
I think what you're telling us as a medical professional, that some of these kind of injuries you're seeing are highly predictable if you just look at the child's schedule, lifestyle, involvement, activities. It's an equation that probably is difficult for a young athlete not to run into.
Absolutely. You know, and sometimes I will know before I go into the room, if I see the age of the kid and what the complaint is, what the diagnosis will be. It's almost that easy sometimes.
You've done it for a long time, and these things do fall into patterns.
Absolutely. So it's one of those things where it would be nice. I want kids to play sports, but it would be nice if kids played all sports or multiple sports instead of just focusing on one thing, which, you know, there's never been any study that shows a kid who focuses on year-round basketball or baseball has a better chance at a Division I scholarship. It just is not there. You either got it or you don't.
Yep.
And
they will find you if you have it.
They will find you, and so
they're funny that way.
The other thing too is if you look at the statistics of professional athletes, the majority of them were multi-sport athletes when they were in high school. So athletes want to compete, and I want the competitors, and so I don't want to. I think the kids who are just thinking that they have to practice all winter, then play in the summer, then play some, you know, they're better off if they were playing basketball in the winter, and then baseball in the spring, or running track, and then football in the fall, or golf, or
There's
soccer,
a mental
whatever
burnout factor too. I think.
Sure.
I don't know that hardly any kid really is born to play 12 months a year the same sport. If they're a real competitor and a real athlete, I think some variance is always very enjoyable.
Well, and then you get burnout too, like you were saying. It might not even be a physical injury, but maybe it's a mental thing, and then maybe you lose a kid to that sport. Maybe he's just done.
Exactly.
And
well, I saw it. Yeah. Absolutely. I'll get you out of here on this. You directed me to a really good article on ESPN.com you wanted to talk about what influences kids' involvement in sports in this country today. And it's not necessarily the things we've been talking about, but go ahead.
Well, yeah, it was when I started thinking about the subject, I just did a quick search, and I noticed there was a couple of really good articles on ESPN.com, and it's talked about some of what I just discussed, but also about the cost of travel basketball. I think they were specifically talking about basketball, but it's really all sports, and how it's kind of pricing some families out of the market, per se. And so there's more kids specializing, and those parents feel like, well, little Johnny needs to get a leg up, so he's got to be on this travel team. Well, there's not all parents can't really afford the cost of some of that, and we're losing out. And some of the local leagues, rec teams that we would used to call them, that were really competitive and good, they're not really.
The league has a problem
anymore.
now.
Yeah. So they're just not there, or they're just not competitive, and you don't have the coaches, and so you get the situation where you have too many kids specializing, and then some of them get burned out, and then some of these other kids that can't participate in that kind of get lost in the shuffle.
Dr. Western is a great source for all of this. If you're listening, you have a child in sports, beyond what he said, there's plenty of academic studies. There's all kinds of studies about this kind of stuff. The internet is available to us all.
Yes.
Some parents are going through it with their child for the first time. They weren't born into this whole situation of being a sports parent, or maybe it's not a family that's had a lot of athletes before now, but this knowledge is power for the sports parent to help the sports child.
Absolutely.
Great pleasure talking to you.
Well, thank you very much.
Glad you can make it. He's Dr. Brett Western of Springfield Clinic Orthopedics. They are our sponsor here at the Shed all week. We will take a break and be back.
Thanks.